Thank you so much. This is a great opportunity to be together and to talk about something that has been, I've been passionate about this for ever since dental school. And one of the first questions is always, what are you doing? You're a dentist. What's this got to do with neurological illness? So I'm from Alberta. I live in southern Alberta, and there's lots of MS in southern Alberta. And there's questions about why. That's a picture I took in Waterton, one of my favorites. I want to look at this. Now, is this one I have to click on? Yes. I want you to watch this for a few minutes. That's me talking in the background. I apologize. I just want you to watch what's happening here. This is a year-long series of MRIs taken on an MS patient. I'll play it one more time. So watch the spots come and go. Whoops. What did I do? There we go. So this is cycling through a whole year's time. All right. So when I saw that video, I think you sent it to me. I get so many good things from Sandra. She's just a real source for me. This is something I've been trying to convey. This movie captures what I've been trying to say. I sat in Bologna in the lobby of the hotel with Mark Hakey, trying to get across to him what this video conveys. So this is an MS patient, a year's time, almost an MRI a week, all right? And spliced together into a movie, right? What do you think his life was like during that year's time, watching that video? Was he in rough shape? You saw the lesions coming and going? Nothing. He had no change in his health. His status did not change watching that video. And so my interest in MS has come from my experience in dentistry, working with patients. And so we're interested in a healthy life. And we're, the Neurovascular Society, we're dealing with the blood vessels that support and drain the brain. So that's just one part of it. But I want to go through some things today to try to show you how dental, the oral health, the cranial cervical health, cranial, I'm talking about the structure of your skull. Are you familiar with osteopathy, with craniosacral therapy? These people work with the healthy give and take of bone, the bones of your skull. And cervical health is, of course, the NUCA. We've already talked about NUCA chiropractic that Sandra mentioned. Brainstem health is relatively new to me. There's people that are interacting with that. And in dentistry is a huge shift in dentistry away from drill, fill, and bill. Fix the teeth to breathe, swallow, and sleep. It's all falling under the umbrella of dentists. And there's a ton of education going on for dentists and research. So what I want to talk about is, I already showed that. That was that video. So, all the work that Bill has done, and so much work that so many other people have done, and I have to include the pharmaceutical industry. I'm going to put this in a category for you that I'm going to call it the system. We don't know the cause. How many times have you heard that? There's no known cause. Every article you read, it starts out with what? There's no known cause and no cure. They said at the beginning of everything. That drives me crazy, okay? The millions and millions of man-hours of looking at this illness, and we don't, is anybody even still looking? It seems like, no, let's just prescribe drugs. That works best. We won't keep looking for the cause. I'm not going to stop, because I've found some things and I want to share with you, and it's starting to expand very quickly. And so I'm hoping out of this meeting today, like I've already learned some things from people that I've met, Cheryl, and looking in your mouths and looking at your heads, there is stuff going on. It's live, real time. Okay, so going back, are you, if we have one of you stand up at the front here and we look at you, Are you like that? Standing here, sitting there where you are at 3 in the morning? Are you exactly like that at 3 in the morning? What most likely are you like?
Sleeping.
Most likely hypoxic because you're snoring. Most likely grinding your teeth because your airway is compromised. That's just something new. There are things happening. You have a dynamic life. Okay, when you're exercising, when you're taking your, this isn't a static condition. And so I'm not taking exception to anything that Bill has said, but it's like, before we start discussing it, what's the cause? Well, we don't know, so let's improve, let's improve this, and let's improve that, and let's try this, and let's try that. Those are all valuable things. But if we're going to look at the cause, we have to go back and look at the specific things that are going on and keep trying to connect the dots, okay? That's what I'm trying to do. So I believe that a dynamic, structural, and functional integration is what's missing, not just with MS, with any neurological illness, and with the general public. Migraines, all kinds of learning disabilities in children, on and on. I won't go into that. Okay, so I want to go quickly through my story just because some of you don't know it. Anybody's, I've talked to these meetings before, but I have been fascinated with the connection between dentistry and MS since dental school. One article that connected the demographics. You know about this, that MS and tooth decay on a map, they overlap perfectly. Okay, it was a study that showed that the north-south gradient, the further, the less vitamin D up to age 15. Okay, so that just captivated me. I've got to figure what that is out. It was a really good study, but they couldn't come to any conclusions, so that got me hooked. As I started being a dentist, I had a terrible time with what the training they gave us in dental school about how the bite works, TMJ stuff and occlusion. I had no clue, and I really felt like I was doing more harm than good because I was, people were sore teeth after I fixed them. Like, what is wrong with me? And about the time I was ready to quit, seriously, I was thinking about doing something else. I learned that Mary Stephans's discoveries that explained to me better how the joint worked. I started using that and felt some improvements. And about that time, I came across 3 MS patients came into my office. They were all very late stage in the special wheelchairs, couldn't inflate their lungs enough to speak. I call them the whispering stage. And it was very tragic, but I used this technique with the bite on these patients. And for general dental reasons, I didn't know what I was going to run into. And I won't explain the details, but just in a normal patient, the technique, we used a measurement device, we used little shims on the front teeth. And with normal, between 3 and 8 shims would disclude the back teeth. So put little shims on the front teeth, and you keep checking in the back, and pretty soon they get enough thickness here, the back teeth come apart. This has to do with the position of the joint, right? Think of it as a teeter-totter. They're hitting on the back teeth, and the joint is dislocating. That's all I was checking. With the MS, all 3 of these patients, I put 24 shims between the front teeth before the back teeth came apart. Blew my mind. Like, what is going on here? I have to know more. So I went to the university and said, I'm going to go in and have a look. So I contacted the university and said, give me all these phone numbers. I called around, and I found 3 cadavers that had died with MS as the cause of death. One was in Edmonton, Alberta. One was in San Diego, and one was in Dalhousie. So this is my second time in Halifax. I flew to those places and did the dissections of those cadavers and discovered something. And that followed up with that. I looked at, I'll tell you what I found in a second, but I found demonstrable mobility in the temporal bone of the skull, okay? So the temporal bone of the skull, I found, is moving. And I went and, I'm trying to go through this really fast because I have so much I want to talk about. I performed a study in San Diego on 10 live MS patients. They are all ambulatory, they came in on their own steam, and we had PPLL is a pulsed phase lock loop ultrasound. Very simply put, you put a sound transducer on the temple right here, it sends the sound wave across the brain to the other side, bounces back, and you can measure the echo distance off the inside of the skull. It's very, very accurate. And we had these patients just clench their teeth, and we measured the displacement, and the MS patients, the temporal bone's displaced 6 times normal, and in several cases 3.6 millimeters. It's almost 4 millimeters. So if those bones are going to the side, the top's coming down, it's a pressure gradient that's happening inside the head. So I found also some cranial abnormalities in an Alzheimer's and an ALS patient, which have opened up, I think it should be opening up a whole new inquiry. Okay, there are things happening inside the brain, live, real time, when we've got to figure it out. Usually, I'm saying at night. So my theory is that neurological illness is a multifactorial condition. Everybody has that theory. It may be caused by intracranial pressure waves or abnormal patterns of blood CSF flow in the head and the neck. These pressure changes may occur as a result of jaw clenching, where the cranial suture integrity is compromised. So I'm not saying everybody who clenches is going to have a neurological illness. But when certain conditions of the skull exist, clenching can cause the bones to shift enough to cause trauma that nobody knows about. It's happening when nobody's looking. Okay? So think back to the video. Okay? What was happening? I don't know what was happening in that man's life that caused those lesions to appear when they did. But the exciting thing to me is, did you notice how quickly they disappeared? Yeah. Okay? And so I'm going to say this, and I hope you can feel what I'm saying. Something is going on, and you can give all the help in the world, and it's all good. But what would happen if you stopped the process that's driving it? What if that pressure wave stopped? I think we would see, well, what kind of recovery did we see with the CCSVI treatments? So many people, it's like magic. It's like, you know, instantly, why did it come back? You know, direct MS, Ashley Embry, okay, he has become a dear friend of mine. He's the one that called me with the announcement about CCSVI. I didn't know anything about it, and we talked many times. And his call to me was, "You were right." That was his comment about that. And here's where I go with that. So, I think I covered everything up there. Okay, so I had this article published in Oral Health magazine in the spring, and this is a diagram I had made for it. So I want you to try to visualize what I'm talking about here. So if you want to participate, you can feel your cheek. Just put it right on your cheek muscle. Clench your teeth together. You're feeling your masseter muscle bulge. Okay, your masseter muscle was attached to this bone and to the jawbone. And when you clench, it creates a torquing this way. Okay, now put your hand here on the side of your head and clench again. You can feel the temporalis muscle. Temporalis muscle attaches to the jawbone down here and comes up underneath your cheekbone and attaches way up where the red arrow is up there, okay? Okay, so when you're clenching like that, you're causing a torquing on this bone right here. And the suture that I found had displaced was right there. So I'm talking about, okay, this is the 3.6 millimeter. We were measuring between here and here. And when these patients clenched, the temporal bones went out, and the parietal bones, the top of the skull comes down. Okay, that's the mechanism that I'm talking about. Okay, so this happens more. I'm going to say in MS it's bilateral, and when I looked at the cadaver of an Alzheimer's patient, one side was absolutely normal, and the other side was displaced. I'm going to say 3 or 4 times what I'd ever seen in an MS patient. So these are specific anatomical changes in the body that are part of this dynamic living system. You're not just sitting there like a model. You live, you chew, you breathe, you get upset. You know the connection between trauma and MS symptoms? It's one of the leading connections is people go through a traumatic experience in their life. What increases when you have trauma? Clenching. You clench your teeth. People grind their teeth, and they've done all those studies, the TMJ studies. What about the connection between women? Why do women get it more than men? How is it? What's the key factor here? You see it? The ligaments that hold these sutures together, okay, are influenced by a hormone called relaxin. That hormone is present every month through the cycle, and especially during pregnancy. Why the connection between pregnancy and MS? Women who get pregnant with MS, does everything stay the same? Huge changes. Some of them have no more problems during their pregnancy, and then when they're not pregnant again, terrible problems, okay? This is an interplay, just simply put. What about the connection between Ehlers-Danlos? What is Ehlers-Danlos syndrome? Ehlers-Danlos is inherited collagen defect. Their collagen doesn't form quite right, so they're very loose joints and laxity. And there's a direct, I'm not going to put through the papers because I don't have time, but there's direct correlations in papers that are connecting with Ehlers-Danlos and MS. And then the last one I want to tie this in is with Lyme disease, because there's a lot of controversy about the role, where does Lyme disease fit into this thing, because so many misdiagnosed situations, it's not MS, it's Lyme disease, or the other way around, it's like a transferable. Guess where Lyme bacteria prefer to accumulate? In the ligament, the connective fibers. So that's my theory. This is the actual picture from back to one of those. This was I saw 11 people who had passed on, just they weren't preserved. The first 3 I looked at were preserved in formaldehyde. And 11 I looked at, and they had come in within 2 days. They hadn't been preserved yet, so the fluids were still mobile. If I press right here on the temporal bone, blood would ooze out of the suture. On the same cadaver, if I looked at the sutures, the other sutures of the skull, they were like the medical profession holds out that sutures after age 15 don't move, clinically significant anyways. And so that was what I found. This is a lady clenching her teeth while we did a 3D scan of her skull. You can see this ridge right here. So what I discovered was that this temporal bone is slightly moving. Now this is what, why is it not working?
It's supposed to be.
There we go. No. Okay, so I just wanted to show you this because I'm tying this to CCSBI, the whole thing with Zamboni. I love this anatomy app. It's just phenomenal. I can play around with it and dissect and separate things out. That green is the temporal bone, right? That's the bone I'm talking about. I aligned it so you can see what goes out there. Jugular vein, okay? You notice it's positioned right between the 2 bones, the occipital bone, okay? So this is very, very interesting to me. So this bone is a styloid process. That's the mastoid. And that bone is tilting. This styloid process is attached to a muscle, okay? It's the stylohyoid and the styloglossus. Both of those muscles are actively involved with the movements of your tongue and the throat, the hyoid. If you feel that right there, just put your fingers on that and give it a swallow. You feel cool. That muscle's active, pulling like that. So what I'm suggesting is as the blood, that's the ear hole up here. That's not anything. The jugular vein comes out. Let's just see some more anatomy here. So the styloid process, for some reason, is hidden on this. It's a diagrammatic error, but the carotid artery goes up into the skull. The jugular vein comes out, and guess what that bone is? C1. Now this is interesting. That's that styloid process. I took this last Thursday on a patient. That styloid process, how long would you guess that is? 8 inches? Okay. Wolff's law is that form follows function. So when you do that, if you're not swallowing properly, if your tongue is tongue-tied, if there's not room in your mouth for your tongue, your airway is compromised, and the entire system is out of sync. And so constant pulling on the ligament that runs from that bone in your throat to that point on the skull where it forms makes this calcify. Well, that extension of that bone is what I'm talking about is moving. Right? So you saw the anatomy there before. Look at those. Those are an indication of malfunction of the tongue, okay, swallowing patterns for decades. Now this is another picture showing that's the styloid process at the top, and that's the muscle running down, and it ends in the air here because it's attached to the tongue. Okay, so this is so intriguing to me. This is what, and that's the stylohyoid, the other is styloglossus. So it's attached to the bone. That's the one in your throat. So I'm sorry about all the anatomy, but this is a MS patient. You know, you've all seen this in the CCSVI journals and things. This is a patient with, you know, stenosis of the jugular vein, and what has to happen? The blood has to get back somehow, so it becomes very complicated. You know, it develops all these reactions, and so when we open those up, and the blood vessels are opened up, that's great, and there's instant increase in perfusion of the brain because the jugular veins are open. But what caused the blockage in the first place? Okay, this is I've been to the meetings with the Mark Hakey and the neurovascular groups, and I've asked the question, what's blocking the blood vessels? And working with Michael Arata, he sent me many patients to look at their TM joint conditions, and now we're tying this in with the C1. And he said, I can see that there's an obstruction as the blood comes out of the skull. Well, I've just shown you the anatomy. We've got this bone sticking down, okay, which is a part of the swallowing complex. What's it doing at night? If the bones are moving, what effect does it have on the jugular vein and the carotid? One more thing. There's three things that are bundled together that come out right by that styloid process. Guess what the other one is? Any anatomists? Pardon me? The vagus nerve. Okay? How much have we heard today about how MS patients have bowel problems? Okay? So the anatomy just is screaming messages to us. There's stuff going on here. We need to keep looking at this. That is a Parkinson's patient. Notice the lack of jugular veins completely blocked on one side. Mark Hakey study of 20 Parkinson's patients. 19 were blocked on the left side, just like that. And one was blocked on the right side. But they all have the blockage. So CCS guys isn't just about MS. Okay? What is it about? That's what I'm trying to say. While all that's going on outside here, my whole contention from the very earliest times was talking about this is what Bill's been talking about. These are the micro blood vessels. Can you see? It's a single cell wall thick. All right. So if you have a trauma to the brain, like a pressure fluid wave through the skull, who's going to get hurt first? A blood vessel that's got multiple layers, or one that's one cell thick. Okay, this is where the damage occurs in MS. The earliest stages, the damage to the blood-brain barrier is the first thing that happens. Well, I think it's trauma. My theory is based on a low-grade, nobody's looking, trauma to the brain tissue that leads to damage inside, and okay, so try to visualize this. If you clench your teeth really hard, and those temporal bones do even the slightest bit of movement, the styloid process is right at the exit. You ever play kids playing with a balloon? You know, they blow it up and then they grab the opening and they pull it and it makes a Donald Duck noise or whatever. Okay, so you've not only got a bellows happening for the skull, but you're pinching off the exit with the styloid process. Okay, that's going to cause turbulence, and the turbulence is what causes the blockage of the jugular veins. That's my theory. Okay, that's what I believe is happening. And so I've been carrying on with this, and I talk about it, and I try to explain. Oh, we went way too fast. Okay, so when I first started studying this, these slides were the ones that really got me going. Because it says, maybe it'll not be one of these, but that doesn't look like that other slide I showed you. These are late MS plaques. These are arteries. These look like arteries, but they're not arteries. These are the same micro veins in the earlier plaque. So what would cause a vein to look like an artery? What would cause a vein to become physically like an artery? Repeated pressure changes. What happens when you take a saphenous vein out of your thigh and do a bypass in your heart? Does it keep looking like a vein with that constant pulsing of arterial blood pressure going through it? No, it does not. Form follows function. So to me, this is huge evidence of a chronic pressure wave that shows up eventually as a change in the veins themselves to handle that pressure. Okay? So I was going to go into the dental part of this, but I feel like I'm happy to explain the dental part of it. I'd rather explain it to dentists because they're the ones who need to know about it. But it is no longer, like Bernie is always giving me a hard time when I give my talks because he's, for David, everything's the bite. He said that at the last conference. And he was right. That was, you know, to hammer everything's a nail, right? And I confess I'm guilty of this charge. However, life has happened, and since the last conference, I have come in contact with an amazing upper cervical chiropractor who is doing treatments of the C1 as he's doing bite changes, having amazing results in neurological patients. And he doesn't know, the thing that I've perfected is the occlusion part of it. Like I've used, I think I will show these pictures of my, is that the end of it? No, that is the end of it, sorry. I had planned to put some pictures of the bite scanner that I use, but I forgot to put them in. Anyway, so that's basically the story, but it is ongoing, and the thing I shared with you today about the tongue activity leading to that extension of the styloid process, that's new to me as of yesterday, because our flight was delayed, and this chiropractor and I were talking for 3 hours over the phone while I was waiting for the flights, and both of us kind of came on at the same time. We're like, oh my goodness. Because I always thought that the lengthening of those styloid processes was just like an enigma, like, okay, this is just a weird thing. They're just growing. No, nothing just grows. It grows in response to...
It grows in response to inflammation.
Inflammation.
Chronic inflammation in and around the bone, the body dumps calcium.
Okay, but...
So that's exactly what's happening, the chronic use.
Yeah, and that's what I'm... Okay, thank you, Bill.
Inflammation, and then you get bone laying down.
Exactly. And inflammation is being caused by direct physical trauma. That's my message about inflammation in the brain. What causes the inflammation that they're accusing the immune system for? I have a cartoon in my head that it occurred to me while you were talking, Bill, and that is, okay, so it's a bank. Somebody broke in and robbed the bank. You call the cops, and the cops all come gathering around to find out what's going on, and what do they find? Who showed up before the cops got there? The janitor. And he's in there dutifully sweeping all these big bills into a nice pile. Clear the janitor did it, right? Wait. That's what we're protecting here. The immune system is just cleaning up the mess. And I can show you reference after reference of honest researchers just saying, there is no autoimmune response here. This is normal immune response to physical trauma. And the way this flows through the other neurological illnesses, Parkinson's and Alzheimer's, and just so I can tell you, I told you what I found with the Alzheimer's case, where the one suture was, okay, did you know that in Alzheimer's and Parkinson's, the damage occurs on one side only? The initial damage is unilateral, okay? And I'm just sitting here saying, there's a physical explanation for that. And did you know that, okay, well, MS is about myelin, and Alzheimer's is about amyloid? No. One of the #1 signs of active disease in MS is amyloid accumulation. They don't tell you that, do they? That is true. And what about, okay, so what I'm trying to say, this is a trauma model. We've got David sitting at the back there. Microbleeds, okay? Where do you find microbleeds? What would a microbleed be from? Let's have a guess. Trauma? Okay? You find microbleeds in people who fall off their horse and hit their head on the ground. You also find microbleeds in MS, Alzheimer's, and Parkinson's. Okay? You know, I'm not trying to stretch the limits of credulity here, but there's some obvious things here that I feel are coming to the fore. I feel like we've got a group, you know, the people that are, I guess the problem as I see it is that dentists are very compartmentalized. You know, you have TMJ experts and you have this. The craniosacral people are very excited about what I'm talking about. I'm presenting all this stuff, and they're the people who are listening to me the most, is the Alpha Interface group. And they're very excited about this. Osteopaths have a hard time with this for an interesting reason. If you know anything about osteopathy, the cranial sutures, it's assumed by osteopaths that the cranial sutures need to have lots of nice, healthy movement. And when they find an adhesion in the bones of the skull, that's the osteopath's job, is to get a nice, healthy movement between the bones. And I come along and say, when you clench your teeth, the bones are moving too much. And I hear them say, no, because they see it the other way around. But this was simple. It isn't rocket science. We measure the bones moving, and I've been trying to find novel ways. The device that we used for this study is no longer available. It disappeared shortly after I did the study. I'm not sure how much of a coincidence that is. Like too much information. Somebody didn't want that to come out. Bill's laughing. You know, how many times does that happen? How many times have they found a cure for cancer, and all of a sudden it just disappears? Anyway, I'm sure you have lots of questions. I have more than you, but I've seen, Cheryl, do you mind if I mention you?
That's okay.
You're okay. So try to understand, this is very, very complicated. Cheryl has, headaches, really, really bad headaches. Her nerve muscle, the temporalis muscles are really tight, and if I push, they hurt. When she swallows, she's got an open bite on one side. When she swallows, if you look at the tongue on that side, it's got impressions, little indents where her teeth are. And she's pushed so hard that it's opened her bite on that side, and she can't close together. And so, this is exactly what I'm talking about. And this functional matrix is, the heart of it is sleep, okay? Bill already mentioned that. If you're not getting that deep restorative sleep, that's having, bad effects on anybody, not just a neurological patient. But the function of the tongue, this is news to me as of September. I did not know. And I finished a myofunctional therapy course. You're probably going to ask me, so what can we do about this? I'll tell you, first of all, there's myofunctional therapy is, they're everywhere. I think you can find them on myofunctional therapists. Guess what they do? They teach you how to swallow properly, okay? The NUCA chiropractors, they work with the upper cervical area. A good biological dentist, or somebody who understands the occlusion part of it. What I believe is going to happen, and I want to be a part of making this become more the case, is that we shouldn't be working by ourselves. The fact that you have to go see a dentist, and he goes, oh, I think there's something wrong with your swallowing pattern, go see a myofunctional therapist. In Calgary area, there's lots of, not lots, there's several areas where they're starting to coalesce. There's one in Toronto, and that's Janice Goodman. She's bringing physiotherapists, craniosacral therapists, osteopaths, myofunctional therapists into her office, so that they are all looking at the patient at the same time. It's where I think we need to go, because this functional part of medicine is, I believe, what's missing. We tend to look at the person standing there, that's the way they are at 3 a.m., and it is not the way they are at 3 a.m. in the morning. Any questions? thank you for talking.
Do we have these biological dentists here? How do you know, is that the way you advertise? Like if I looked you up?
You know what, I'm gonna say that it's not necessary. Biological dentists do a lot with chemistry, the chemistry of dentistry. I'm gonna say, I don't know.
We do.
I'm sure you have biological dentists here, but that does, okay, what I'm trying to say is that a biological dentist who will make sure you get your mercury fillings out the right way, that doesn't mean he understands the bite, what I've been explaining to you about the bite. So you know what I do, and I have them in my pouch, I'll show them to you. I have my patients, and I've been selling aqualizers out of my website for years. And you know what? They're still, MS patients are still buying them. An aqualizer is a little cushion, a little plastic cushion that fits between the back, and so that when you close your teeth on it, it's like a place to rest. Thank you, right here. Oh, you can wear them. You can wear them anytime.
Like a silicone wrist guard, but for your teeth.
You can pass these around, one on each side.
Anyway.
All this other stuff came up. So I'm learning so many things so fast that it's hard to stop and get it available to you. But have a look at this aqualizer. You can order them online, they're like $15 or something. That's a pretty cheap bet. But
And the money goes to David's research, by the way, and because he's done all of this on his own dime. And when you wake up with the aqualizer in your mouth, it's like silicone, and you wake up and you go, do I still have it in my mouth, or did I swallow it during the night?
Yeah.
I must have swallowed it.
You've
because
never
my
had anybody
mouth is-
swallow it yet.
My mouth is nice and relaxed, and I don't feel anything in there, and you go, oh, there it is.
There it is,
know?
yeah.
Would you swallow it?
No.
No.
It just melts into your
No,
teeth.
it just, once you've had it in for 15 minutes,
Yeah.
the muscles of your jaws and face, they've shown this, said an EMG, put leads on the muscles, and they're like this when you put it in, and in 15 minutes it's like a flat line. The muscles just, because there's no argument between the back teeth. I haven't talked to you about the physiology of the bite that leads to all this, but you don't need to know that, your dentist needs to know that. But the aqualizer is all you need to, I won't say that's all you need, but it'll get you by in the short term. And one of the things I tell patients is to wear the aqualizer all night with you. At first, don't be alarmed if you pop it, but you have to kind of have a chat with your subconscious, because it's your subconscious that handles you not swallowing things. We used to play tricks on the kids in the car that fell asleep with their mouths open in the car as they're driving. You put a piece of, roll up a ball of Kleenex and put it in their mouth and see what they do. And they would always just spit it out. Out it goes. Yes?
Would one of these replace, my daughter clenches her teeth at night and she wears a mouth guard.
Yeah. Dentists are famous for making mouth guards.
Yeah,
I'm telling you that grinding your teeth is a function of airway challenge, not
so
contact.
this would be better for her.
This would be better for her, but she should also maybe look into, get a sleep study done. Because a lot of the bruxism, like dentists have been making splints, bazillions of splints for people because we thought it would help, and the proof is, what I would look for is a sleep dentist. That's what, and there are lots of them. I would rather have you see a sleep dentist almost than a biological dentist.
In the States? Yeah.
I don't know what they're like out here, but if you can have any influence, some dentists are so nice. There are dentists that are so kind, and they become like part of your family. So get really close with your dentist and say, go take this course in sleep, okay? And that's where they'll start, and try to work through that way. But
Mine told me I just formed bad habits while I was sleeping. That's why I clenched my teeth.
yeah, that's not the whole story. There's lots more to it.
Didn't help me either.
Yes.
So should you ask your dentist for a bite test? Is that what you're saying, it's a
Yeah.
starting point?
Okay, here's a couple of T-scan. I'm sorry I didn't include the T-scan in my presentation. It's a bite computer. Okay, how many have the dentist put the blue ribbon between your teeth, or a red ribbon? They bite on the ribbon. Guess what it shows you? Your teeth are touching. Whoa, I didn't know that. Thank you. But if I showed you a T-scan, I'm so mad I didn't put it in there. When I had a patient who came in, he was my neighbor, and he came over and he says, can I come see you? Because my other dentist is saying I need 2 root canals over here. And they ache all the time, okay? I had it bite on the T-scan, and it's live, real-time contact being scanned 100 times a second. So when he clenched on it, so when he clenched on it, it's like the shape of your jaw, right? In the computer, the shape of the jaw, and it has 3D colored bar graphs. Is that cool? And when he clenched on it, it went like this, like the bar graphs went up like this, popped down, went back up over here, and then the back just went bam, and it held like that. So he was hitting on one spot, shifting away from it, hitting on another spot, hurting that tooth, and shifting back, and then they all engaged. And when he was done, it was 35% of the force on one tooth. I wonder if he needs a root canal. Okay, we adjusted the bite and leveled it out using the T-scan, and saved him, $3,000 in root canals that didn't need to be done. So many root canals are done. If you have friends who say, "Oh, I got a sensitive tooth, I think I need a root canal," no, they need to look at the bite first. I'm not saying they don't ever need to be done, but about 60% of root canals I don't believe need to be done. They're just, we can't find what's hurting you, so let's do a root canal. Works for me. Thank you. Cheryl.
When I get the MS exhaustion,
Yeah.
where you just can't hold out for very big amounts,
Yeah.
my throat swells internally,
Yeah.
where it doesn't feel like you can swallow.
Yeah.
Is that because of the line in my jaw, the tongue?
I think that's neurological. But honestly, the most exciting thing that's happening is the connection between the upper cervical. Get a NUCA chiropractor, get him to fix that first cervical vertebrae, and if you can get him, I really think that an aqualizer, I'm trying to find the best way so that most people can get benefit. If you're wearing an aqualizer while you see a NUCA chiropractor, I think that's pretty much the fast track. And then sleep dentistry, myofunctional therapy, so you're swallowing. You really need to see a myofunctional therapist. They'll do wonders for you. We've seen people who just relearned how to swallow, and their sleep apnea goes away. Crazy stuff like that is happening all the time.
Well, I use Amazon and freeze all the inside of my mouth before I can lay my head on the pillow and sleep.
Oh, I know, but that'll all change. Form follows function. The way your teeth are is because the way your tongue is making your teeth go. All about swallowing. I didn't know that. I did not know that until September this year. Crazy, yes?
What, this may or may not be relevant, but what about CPAP?
I had CPAP for 20 years. By the way, my story, I had braces when I was 13. They put the headgear on because I had buck teeth, which is the reverse of what they should have done. I had an underdeveloped lower jaw, so they made my top jaw slow down to match my lower. Pushed my whole mid-face back. That thing you're saying, Bill, about the airway thing with the tubes? The palate, the roof of your mouth, they say add 1 millimeter of palatal space, you add, I forget, 20% to your nasal airway. So many people, their blockage is up here because their mid-face is underdeveloped because of orthodontics. Ooh, that's on video. That could get me in some serious trouble. But I'm telling you, it's true. And there's a revolution coming, and the parents are starting to see this. If you look at someone whose profile, okay. If you look at, I go through shopping malls and airports, and I'm just shuddering the whole time because I can tell who's had braces, especially at the class 2 where your chin is underdeveloped, and they look like beak, mid-face, chin. It's just, they've taken away all that growth, and now we know what causes the growth. Guess what it is? Function, okay? In Africa, you've got me on a roll now. In Africa, a pregnant woman grows one fingernail extra long and sharpens it. When the baby's born, she pinches his jaw like this, pops it open, and she does a sweep under his tongue and cuts the ligaments on the base of his tongue. And does the same on the top, and then puts him on the breast, okay? They don't have any orthodontic problems. They suck like little babies are supposed to suck. And the physical activity develops their midface. And guess what happens when their teeth come in? We feed them pablum. They don't have pablum. They don't have blenders. They chew on a root. And they've shown all this work's been done. If you chew hard when you've got teeth, your face develops right through. And so now there's treatments calling orthotane, and there are different things where they're giving kids at early ages these little chewy things. And they're designed to stimulate exactly the kind of growth that you want. And not braces. And the earliest possible time, get these kids chewing hard and get them habitually chewing, and the stimulation of chewing grows their midface, okay? And get them swallowing properly. Anyways, there's so much happening in dentistry, I can't keep up. But now you're kind of caught up. I'm done.
Any more questions?